All
right. Looks like we're recording. Okay, we're all good. So hello, everyone who's here. Thank you for joining us. I am Andrea Carvalho. I'm the program coordinator for the Coalition to Prevent Lead Poisoning. So I guess I'll just kick off by going around and calling the people I see on my screen to introduce themselves. So I will start with Mel.
Hi, I'm Mel Callan. I'm a family nurse practitioner at Highland Family Medicine. I've been there for many years. I'm also chair of the Coalition to Prevent Lead Poisoning, and I welcome everybody to learn from this webinar that we're going to have.
Jeez, I'm sorry. So thanks, Mel. And just to recap, we're so thankful that Mel could be here to talk to us today about how lead poisoning affects a child's health. So thanks, Mel.
Sure.
And I will switch it to Elizabeth.
Hi, everybody. Great to see you this afternoon. Thank you so much for taking some time out of your day to talk about this issue. I'm Elizabeth McDade. I am the program manager for the Coalition to Prevent Lead Poisoning and the program coordinator for the Rochester Energy Efficiency and Weatherization Program.
Okay.
Thanks, Elizabeth. I see Linda's also here.
Yep, nurse for the Monroe County Department of Public Health Childhood Lead Poisoning Prevention Program.
Thanks, Linda. And there's somebody on the phone. If you can unmute yourselves, I'll let you introduce yourself.
If they can.
All right, that's okay. If you can unmute yourself later and chime in, we'd be happy to know who you are. Oh, there we go.
Hi, this is Shallie Saney. I'm a lead sanitarian at the Monroe County Health Department.
Hi.
Welcome.
Thanks for joining us. All right, so I think then in that case, we can just get started with the questions. Like I said, really grateful that Mel could be here to help talk about how lead affects children's health and some of the things that especially parents should look out for and be aware of. So I'll start with the first question. Mel, if you could just give kind of a background on what is lead and how it overall affects children's health.
Sure, and thank you very much for having me. And we have other experts that are joining us today. So please, intercede anytime that you think another point needs to be raised or anything else that would help our parents who really are interested in becoming informed about lead poisoning prevention. So lead is really a natural occurring chemical that is in many parts of our environment, the air, the water, the soil, and even in our homes. The most common source of lead poisoning that we really focus our efforts on are structures like homes or schools or daycares, and especially those that were built before 1978, because that's when lead was not allowed to be in paint anymore. And the reason they put it in right from the beginning was because it helped its durability for the paint. But the major sources of lead poisoning really that we deal with as a community is from the structures like homes or rental units, whether it's a homeowner or a rental unit. And it's throughout the county. Certainly lead paint poisoning is throughout the country, but here in Monroe County and surrounding counties and throughout New York State, we really focus on what are the risk factors for folks in our communities throughout. And that is lead paint poisoning that can occur in our homes, especially those that were built before 1978. Now, the effects on children are pretty significant. And fortunately or unfortunately, you can't really detect lead paint poisoning in a child unless, you're not going to see really obvious signs unless it's really, really high. And we really don't see that in our community. So the insidious ways that it can affect children is really in their development, particularly their brain development, but it can also affect their bone structure development, their blood development. And it really starts from the point of when they start crawling, which is about 6 months, to usually 5 or 6 years of age, because children often have a lot of hand-to-mouth behaviors, and especially when they're crawling along the floor, if a home or a unit has some lead paint poisoning in the dust, either from the friction of the window going up and down or the doors opening, and it's real fine dust. It's not like big globs of dust. It's really fine dust material. And so as they crawl along and have that hand-mouth behaviors, then that's how they ingest it into their bodies. But also, a pregnant mom can expose, if she's been exposed to lead paint poisoning, it can affect the baby that's in the womb. And so our efforts are to try to prevent lead paint poisoning right from the beginning. As I said, it can affect the brain, the kidneys, the bones, the blood, and the behavior problems are really pretty significant. Lack of impulse control, inability to focus, and lower IQs as they start their learning programs in their school years. And these kind of effects can stay through them through adulthood. So even as they grow up into school age and teenage years, it can lead to some juvenile delinquency behaviors. Later in life.
Excuse me.
Yeah.
I just wanted to add, so one of the things that I've heard is that our bodies cannot tell the difference between lead and calcium.
Mm-hmm.
And that one of the things are, if we don't have enough nutrition, et cetera, our bodies are looking for calcium. That's one thing. Not to say you can drink 2 glasses of milk a day and you're fine. We know that's not true. But my understanding is that when you're talking about the brain development, the issue is that in brain development, our synapses need calcium to develop and to make those connections. And that if we have lead in our body, our brain can't tell our bodies can't tell the difference, and we'll use the lead, and the lead actually stunts those tree branches, those synaptic connections. So when you're talking about permanent brain damage, right? You're talking about the inability for the brain to function and to have the normal pathways of information and resources that it would in a brain without lead. Is that correct?
Yes, that's right. And that comes up, the importance of nutrition, particularly calcium ingestion, comes up later as well as we discuss this. But yes, and in adulthood, it can lead to kidney disease, hypertension, which is elevated blood pressure, and affects, the heart and the kidneys. And so a lot of long-term effects, as well as effects on young children as they begin to have their brains develop. And yeah, those synapses are actually nerve endings that connect with each other. And that's how our brains develop over a period of time. The most important time for brain development really is in the first 2 years of life. And then as we get older, the children reach a school age, that process continues. But the bulk of it really occurs in the first 2 years of life, when kids are always putting their hands in their mouth. Anybody else want to chime in on that kind of information? I also want to emphasize that if a child has an inability to focus, or has some lack of impulse control, they just can't control themselves, it could be from lead paint poisoning, but I wouldn't jump to that conclusion. There's a lot of things that go on in a child's brain development, in the home environment, in genetics, that can affect all those traits, lack of impulse control and IQ levels. But certainly finding out if it's because of some kind of lead paint poisoning is worth testing for it. And that gets us into
Well, I was going to say, you bring up a good question about knowing when to test, but I also just wanted to go back when you were talking about the dust. People think that somehow they're going to see this, or that somehow it's a visible thing. And in some ways it's invisible, right? It's microscopic dust coming from friction surfaces, from opening and closing windows, and opening and closing painted doors, and walking across old painted porches. So sometimes you can bring the dust in on your feet, etc. So it's, I mean, that's why being proactive rather than reactive, and is so important. And I guess you're going to tell us next about the law for getting kids tested and what you need to do with that.
Yeah. Certainly it is a law to have kids tested at 1 and 2 years of age. Not a lot of parents understand that. In fact, not a lot of healthcare providers understand that. Unfortunately, some healthcare providers think, oh, my family's in my practice, they don't live in old homes, or their homes are freshly painted, we don't have to worry about it. And that's not the case. Regardless of where people live, where families live, what condition their homes are in, kids need to be tested at 1 and again at 2 years of age. And that is critically important. And so we are trying to not only educate parents, but healthcare providers as well, that they need to continue to do this. Because it may not be lead paint poisoning that's obtained from your personal home, but what about where they go, where they spend a lot of their time? What about a babysitter's home? What about a grandparent's home? What about the daycare centers? So these are all potential resources or sources of lead poisoning that may go undetected unless the child is tested, both at 1 and 2 years of age, but also if a mom, a parent, or a healthcare provider has any question about, gee, was my child exposed recently? They went into an older home, maybe a behavior question. The child can be tested even times other than 1, 2 years of age. And sometimes I've tested at 6 months of age because I had some concern about the possibility of lead paint poisoning in the environment. Now,
you bring up a good point, this idea that, it's only 1 and 2, but honestly, you can get a test up to age 18.
right.
And if you think you're living in a place that you might be exposed to, I mean, that's good practice. And then also, asking your doctor, what was the test number and all of that stuff, and requesting your doctor to do the test.
Or your nurse practitioner.
We also,
or the nurses in your practice, they often are the ones that follow the labs of the patients in that practice. And it's nurses in many of the practices that are really on top of it for lead paint poisoning and getting kids tested. Linda, were you going to say something?
Some of the physicians that I've spoken with, we encourage them, if it's a winter baby, to also test them at the halfway mark, because that's when they're outside more, they're out on those peeling porches more.
Good idea.
So we ask them, hit them at 18 months too.
Yeah.
So can you describe what a parent would expect when they take their children to get a lead test?
Sure. So there are a couple ways that kids can get tested for lead. One is called a finger stick test, where the kid's finger is literally pricked, similar to the way diabetics check their sugar, where they prick their finger and the little strip goes into a machine. This finger stick testing is not done at home like it is for diabetics, but it is done in many offices. And so they can obtain the level of lead in that office right there. And they can, what we call, screen kids to see if there's any concern about the reading that we're getting. Now, the other way, and I'm going to talk about what is a good reading for a result for a lead level, but the other way is just a typical venous blood draw. How people go to the lab and they have their blood drawn through their arm.
What does venous mean?
Well, usually in the crux, right at the elbow, in the crux of the arm, there are veins that people can get their blood drawn. And I'm sure most families have members that had their blood drawn. So yeah, and kids get it done the same way. Parents obviously have to take them to a lab. And that is, the availability of labs is really limited in some regards, in some communities and some neighborhoods. So that's why the point we call the point of care testing, or the lead test that is done in the offices was really initiated because it was challenging for some families to get to a lab to have the blood test done. However, if that finger stick blood test is any indication that it's an elevated lead test, then we like to confirm it with a venous sample, and that is a test from the arm. And there are several labs around, but we have to admit that sometimes it's hard for families to get to those labs. So we do the ordering of it is easy to do, but it could be a challenge for families to get their child to a lab to really get that what we thought could be an elevated lead level, to get it confirmed. And what is an elevated lead level? Well, the CDC uses what they call, there's no normal amount of lead in the blood.
Mel, what's the CDC?
Yeah, I'm going to talk about that. The CDC is a Center for Disease Control, and they help, it's a national organization in the government, and they help guide us on what are normal lab values on a number of things. And they also guide us on how we handle certain diseases. That's why they call it disease control. And so they admit that there's no safe level of lead, but they call 5 micrograms per deciliter a reference level. That's how they refer to it. It's a reference level. And it's to identify levels that are higher than in most children. That's how they describe it. Nevertheless, the number 5 is what we look for, and what the health department looks for, and what the labs look for. And interestingly, all the, and Linda can chime in here, all the levels are reported to the health department because they do a great job in following those that are really elevated. And I think, Linda, if you want to talk about that a little bit, I think that would be great, how you follow children and their families who have elevated lead levels above 5.
Well, it starts first thing in the morning when I get the labs in, because the providers post them through NICIS and then into LeadWeb, which is all part of the health commerce system with the state. We get the labs in the morning. If it's a finger stick of 5 or above, then I send out a request to the family to follow up with a venous. If it's a venous of 5 or above, then we start a referral for case management right away. And I refer it to the sanitarians to contact the family to go out and help determine the source of the lead. Plus we send them educational materials. We can do a home visit and then keep tracking it. Depending on how high it is, we'll tell you how frequently they have to be retested as we watch those levels come down.
Linda, I have a question. So the Monroe County Department of Public Health has titles for people, and they do call them sanitarians, but it sounds like a weird title for somebody who's going to help a family figure out where there's a hazard for lead. And so I just want to make sure people know that they're not going to go out and sanitize your house. They're just, you know what I mean?
Wish.
Yeah, right. But they're just, and they're case managers, they're people, and this is actually one of the things I think is important is this is a free service, right? This is a public health issue. And so after you go to the after you go to the healthcare professional or the family nurse practitioner, you get your blood work done. If there is an issue, there's lots of resources in our community to help with this. And the public health department, the lead poisoning prevention program that Linda is the number 1 place to go, because they are the experts and they will work with families for a long time to make sure that any place that the baby is spending time or the child is spending time, right? It could be the house they live in, it could be another parent's house, it could be a grandparent's house, it could be a variety of places. And your office really works to help identify where the hazard is coming from, and then to help the family make the home safe. Is that accurate?
Yeah, and one of the things you had mentioned earlier, Mel, was about it could be a daycare, any place that we find out that the child spends more than 6 hours a week at becomes a secondary referral. So it can be a daycare, grandparents' house, a friend that watches the baby while the parents are working. They become a referral also, so that the sanitarians / lead inspectors go out and they will check for the sources in those addresses as well.
And I think Elizabeth and Andrea would agree with me. I know that we are very fortunate. Our Monroe County Health Department, their lead program is top notch. They've been cited throughout certainly the state of New York and throughout the country as for the good work that they've been doing. They work very well with our Coalition to Prevent Lead Poisoning. We have meetings once a month, and there's always somebody there from the county health department as well as from the city of Rochester. So it's a wonderful example of collaboration that we're all trying to look out for our families and the community. And we're just so proud of the folks at Monroe County Health Department and the city of Rochester who are working with us to really reduce the numbers of lead poisoning in our community and prevent it from getting so high that children, as I said before, there is no safe level, but some kids have been known. Remember, I said 5 is the reference level, but we have had very few, but some cases where it's been as high as 45. And that's extremely high. And children have to go into the hospital to be what we call chelated, to try and draw out that poison from their body. It's a very rare.
You make a good point that, so there, some people think there's a cure for lead poisoning.
Right.
Can you explain a little bit that chelation is not a cure?
No.
That it's a very invasive medical treatment in response to a severely poisoned child?
Yeah. I thought I had mentioned before, but maybe not. There is no cure for lead paint poisoning. But I don't want families to panic about that if their child has been lead paint poisoned, because most of our children who do have some elevated lead levels, it's very, very small amount. It's rare that we have ever seen somebody get as high as 45. But when they do, yes, they have to go to the hospital. They're given an intravenous line, IV line that's called, and they're given fluid through that. They have to be admitted for a few days, and they're given some medicines, other kind of chemicals that helps draw out that lead poison, that lead poisoning from their blood system, so that it doesn't continue to affect their kidneys, their hearts, their brains. And it's not a pleasant process, but fortunately for us, we have such a good handle on really reducing any kind of elevation in lead with our children, that it's rare that it gets to that point.
You bring up a good point, this idea also of the collaboration and the proactive addressing of this stuff. So, you have a patient that has an elevated blood level. That data gets sent to the Monroe County Department of Public Health. They work with the family to do case management. You're also working with the family. You haven't just, thrown them off to somebody else. There's a continued effort to communicate and to help make the family, make them safe. Sometimes there are grants that the county has that they're able to help administer, to help, if it's a rental property, then the landlord can make the improvements. Sometimes the city of Rochester right now, for example, has lead grants. And so the county will make referrals also to the city to get the landlord or the property owner into the program to get the grant so they can make their property safe. But I just want to sort of highlight, there's, the county health department is relentless in terms of identifying where these struggles were. And I remember there were a couple of cases several years ago, and you guys identified that there was a family that a little girl was being lead poisoned from the dust in her dad's beard because he was doing construction work. And there was another little girl whose family, whose religious practices include the use of sharma, which is a type of eyeliner. And it turned out that some family members were bringing what they thought was the good stuff from their home country, and unfortunately had lead in it. That's how the little girl got poisoned. But, I cite those examples as ways that the county health department is not going to give up. They're going to keep figuring out, where is the source coming from, and work with the healthcare provider and work with, people to try to make sure that the properties are safe. There's sort of a pretty good safety net that looks at all of this. And I don't know if you want to talk a little bit, we're supposed to talk specifically about being in the doctor's office, but one of the proactive things we have is the lead ordinance. And that requires that, the city of Rochester have inspected rental properties so they don't have lead hazards in them.
Yeah, and I think, you know, as you say, that the health department, they do tremendous investigative work, and they will find the source of what's happening with that child that's causing the elevated lead levels. They are excellent in doing that investigative work, but it takes time and it takes effort. And I'm glad that so much of our tax dollars, what does go towards that kind of a program in the health department, that it's a good thing and a good utilization of our tax dollars for that.
Mel, I have to ask, are you seeing a lot of people coming in for childhood immunizations? And do you want to speak a little bit about the requirement for attending virtual school and still getting your immunizations and tying that into lead tests?
Yeah, there's, you know, even among healthcare providers, there's some controversy about that. You know, well, they're not going in, if they're doing strictly virtual, why do they need to be caught up on their immunizations? But it's so critical that kids stay immunized. And
But the health department, the New York State Health Department told everybody they had to be, right?
right.
Yeah.
And we aren't finding a lot of people coming in, although that's changing over the last few weeks. They're now feeling more comfortable in coming in for their well child checks. School has started already, and we are seeing some more. Even before school started, like in August, we did a number of sessions where we just did well child checks to get them through when they would be prepared for school. But yeah, there's a significant number of children still that are behind in their immunizations, and it is, you know, unfortunate. And parents, I can understand, are concerned not only of bringing them in to the offices, but when you look at the great job that Monroe County is doing, particularly our health commissioner, Dr. Mike Mendoza, who I happen to work with in my practice, what the efforts that he and our county administration, along with the city government, are doing to keep our lead levels or our COVID numbers down. We are very, very low compared to other communities throughout New York State, much less across the country. However, we can't, you know, give up on that. As you hear in the news, there's a lot more indoor gatherings, sometimes in public places. It's unbelievable how some try to get by with the mask wearing. And even I see outside in some parks that families or organizations are having get-togethers, and I have driven by and no one is wearing a mask, and they're certainly not social distancing. So when you combine that with a flu season that's coming upon us, and so how people need the flu vaccine, especially children, it's just critically important that we maintain the social distancing, the hand washing, and the mask wearing whenever we go out and get our kids immunized. And I do think, as in my own practice, I am finding that families are more willing to bring them in now for not only immunizations, but to get their children checked for their annual well child check, and also for some acute problems. You know, they're not feeling well, they've got a cough, they got a rash. There seems to be a better comfort level in bringing them in now.
Yeah, we're seeing a lot more downstairs on the first floor where we have immunizations. They've been getting a lot more families coming in now to get their kids caught up.
Yeah, it's so important to keep those immunization rates up and to have your child fully immunized so that we don't see the spread of other communicable diseases other than COVID and the flu.
Well, your point also about, well child and the importance for chronic health issues, because we're spending more time at home, right? Yeah. There may be additional asthma triggers because we're at home more often. There's certainly a potential, if you're spending more time at home, for exposure to lead hazards, all of those things. So this idea of, making sure that we are also maintaining our health, and especially with the colder weather coming, all of that, we want to make sure that people are up to date on all of their shots and are staying healthy, and that they're getting their lead tests. Yeah.
Oh, you raise another good point, because when I go to Lowe's or Home Depot or any of the local hardware stores, a lot of families are doing projects at home, some renovation.
Yeah.
And what people have to realize is that they should be doing so according to lead safe work practices. If you're a homeowner, if you're a landlord, if you're a contractor. And we can tell you that our Coalition to Prevent Lead Poisoning website has all kinds of information for contractors, for homeowners, for parents, for healthcare providers. But it is so important that all these projects that people are doing in their homes has to be done according to lead safe work practices, particularly on structures built before 1978. Because what you're doing when you do a home project like that, you're just distributing all that old lead paint in the dust in the air, and that is giving cause for lead paint poisoning and elevations in our lead levels.
So are there other things that parents could do at home to help prevent lead exposure?
Well, particularly in homes that were built before 1978. Now, that doesn't mean that every single home is, and the family that lives in a home built before 1978 is at risk. They're at risk if the paint is not intact. If you see chalking on the wall because the paint is not been kept up to date, or if you see like chipping in the windowsills, chipping on the walls or on the doors, and the friction of the windows going up and down, the doors closing, that's what causes the paint dust. So to really evaluate a home, if particularly, as I keep saying, if it's built before 1978, because remember, after 1978, they didn't allow the lead in the paint. But I think, correct me if I'm wrong, Elizabeth, I think 90% of the homes in Rochester were built before 1978. I know there were numbers out like that.
Pretty close.
Yeah.
I mean,
And
any town or city along the Erie Canal in New York State is going to have old homes. So any communities around the canal are going to have older homes.
Yeah. So really looking at every aspect of your home, the floor, the walls, the doors, the windows, things that you wouldn't think of that children really would have access to, especially the young ones. You know, they climb up and they get their hands on the windowsills. And again, it's that constant hand-to-mouth behavior that even many adults continue to do. We've always got our hands in our mouth, or a pen that we're putting in our mouth, and that's been laying somewhere. So it really is.
I just want to go back to Andrea's question. So if we're home washing our hands with a sanitizer for COVID, is that good enough for lead dust, or should we be using soap and water and singing the birthday song?
Soap and water is always the best fallback wherever we are. The hand sanitizer is only when you don't have access to soap and water, even for COVID. Yeah. And of course, there are many situations where we don't have access. You're
I think people think the sanitizer is better, right? Because it's chemicals and it's in a jar. Somehow soap and water is old fashioned, but really soap and water is the best thing.
Oh, especially for the lead dust, because the sanitizer doesn't rinse. It just sanitizes. You still need to rinse your hands off.
Right.
The other spot we notice with little ones is when we go into the older homes, the chipping paint that's along floor moldings and door moldings that'll have in some of these houses 4, 5, 6 coats of paint, and they get that chip is right at their level and they can just pick at that frame.
Yeah. It's lead paint poisoning is a serious condition, but there's so much that we can do to prevent it, and that's why we want to do these kinds of information gatherings for parents, for providers. I'll tell you an example as a provider. What we do in terms of hand washing, we have to use, of course, soap and water, and we have to keep washing like between fingers, get that thumb and start from here down and rubbing, and for at least 20 seconds, we have to keep doing that. And then when we rinse, you rinse with your hand, the water going from like your wrist downward. And then you take a paper towel and you shut the faucet off with the paper towel in your hand. So we try to be very careful in the healthcare offices because we really do need to protect the patients that we serve, as we are trying now in COVID by wearing the shields and the masks. And so hand washing is particularly important for all of us, but to assure families that when you go in to see your healthcare provider, we are given guidelines on how we have to keep our hands sanitized and washed with soap and water. There's no way to do it other than with soap and water and make it safe for when we touch people to examine them. But the same thing holds for families at home. It's the good old soap and water and cleansing the hands and getting rid of the lead dust. Children, they get their hands
and
under the water.
And taking your shoes off when you come in the house is also a good way, right?
Right.
Because sometimes, I mean, because lead is an element, and it was, you know, in our gas and in our paint, so it's out in the environment, and you know, we can also bring it up if we're walking across old painted steps and stuff. So just even taking your shoes off when you come in the house is a great way to reduce the amount of dust and dirt that could be that could have lead in it.
Right.
And also maybe using a damp Swiffer mop or something like that to clean up. You don't want to use a broom because it can, you know, that just makes the dust kind of move around. You kind of want to, you know, a damp Swiffer is always the best way if you think you see some dust on the floor, etc. That's where the baby is spending time, right?
And it's not only the porches. Remember, some of these old homes also have peeling paint on the outside of the house. And so it gets into the soil. And kids go out and they're playing in the dirt and they're getting exposed to lead hazards just right there in the soil from the old homes that haven't been painted with lead-free paint as of yet, or a lot of chipping in a lot of our older homes.
Yeah, one thing that I've heard you, Elizabeth, say that I thought was really helpful to hear too is like, if you have an older home and you're worried about chipping and peeling paint, and you know that your baby's room, for example, has a really, you know, chipped windowsill, but maybe mom and dad's room doesn't as much, then even maybe switching where the baby sleeps, where the baby plays, can help avoid some of those hot spots. If you get your house tested, which in you know, normal circumstances, any resident in the city of Rochester can request a free home lead inspection at the city of Rochester. And you know that one room is like more of a hot spot for lead than another, then, you know, switching where your child sleeps or where your child plays, where they're spending most of their time, can also help.
That's a great point, Andre, because, you know, and part of this conversation and why you want to make sure people understand all the steps is because A, not knowing doesn't make it go away. And B, you know, you need to know so you can actually do something. And there are lots of things you can do, you know, from as simple as making sure, you know, now we're all in the habit of washing our hands, but we want people to understand the importance and of making sure we know and that we're getting kids tested, but also not, and understanding why they have to do it, but also not terrifying them to the point where they don't want to do anything because it seems too scary and overwhelming. There's lots of resources out there. There's lots of people who have information. There's lots of ways to address this. And if you don't, I mean, to not do it is actually the more problematic, right? There's, you know, and that's when we're sort of talking about the lifelong health deficits in both children and adults. And we know how to take care of the problem, so we should.
And Elizabeth, speaking of the amount of lead dust, use your sugar packet analogy.
Well, somebody actually Art Wheaton was telling me we have to do less, not even a full sugar. It has to be like a sweet, one of those diet sugar packets, because it's a very little amount of dust. Are you getting it there? Thank you. There we go.
That's how much.
What is that? Oh, are those sugar particles on a thumb?
That's just lead dust from wiping your finger on a windowsill.
Okay, because it's hard to tell what that picture is.
That's as much as it takes to elevate a baby.
Yeah.
And it's a very small amount of dust, and that's in an entire house. So if you took the sugar packet, right, you took Sweet and Low and you sprinkled it around your house, that site would be considered contaminated. So it's a very, very small amount of dust. I mean, micrograms per deciliter, we should get a good visual on what that looks like because it's a very, very, very small amount.
One question that I also hear a lot that I just wanted to throw in there is a lot of times I know people are familiar with lead poisoning because of what unfortunately happened in Flint, Michigan, where the bulk of the children who were exposed to lead was through lead in the water. So I wanted to ask, is that something that parents should be thinking about in our region? And, what should they consider when they're thinking about lead in water?
Well, Elizabeth, I'll have you chime in as well, but this is another way that our community does such great collaboration, because we have had presentations by the Monroe County Water Authority and learned what they do in the area of preventing lead paint poisoning. But it has to do with the pipes that, well, Elizabeth, I'll let you further explain that. You're much better at that than I am. I'm more clinically oriented.
I was just trying to look. I don't know if Andrea, if you want to find it. I just found it. The link for this. So the city of Rochester, in particular, will do. Well, actually, if you're a city resident, and I just found the link, that's what I was looking for. They will actually do a test. They will bring out the bottles, and you can do the whole test to make sure that your water is safe. The majority of our properties in this community, we don't see a lot of issues with lead poisoning coming out of water. We just don't. We're lucky like that. I'm not saying it's not a possibility and it's not an issue, but we have a lead safe schools policy, so they routinely test all of the water outlets and so forth in the schools. That's throughout Monroe. That's definitely in the city of Rochester, and Monroe County has definitely looked at some of that stuff. Families, again, if you just want to, be proactive about making sure, you want to flush your toilet when you get up in the morning, run some cold water only. You want to get the water that's been sitting in the pipe overnight, and that's how lead gets into water. It accumulates because it's been sitting. So if you get up in the morning, you flush the toilet, you wash your hands, you don't drink the water. You run the water in the kitchen faucet on cold for, a minute or two, whatever. You just kind of get it out, you get it moving, and then you cook with whatever you're going to cook with. Chances are you're not really going to see that big of an issue. I'm not saying it's 100%, but we in general have not heard about that. Sorry about that.
We encourage parents to run the water first thing in the morning to get whatever has leached out overnight from sitting in it. And we tell them to never use hot water from the tap to make baby formula for the same reason.
That's super important. You're right. Never use hot water for baby formula. I mean, from the faucet anyway. But it's, in general, we have not heard that in our community. Doesn't mean it doesn't 100% not exist, but our children have identified as being poisoned by paint sources, and we've been able to, we haven't really talked about, our community has seen an over 80% reduction in the number of children reported with lead paint poisoning. And that's because, we've got great doctors and family nurse practitioners and health sanitarians who are out there promoting, talking, making sure parents are informed, making sure that healthcare providers are following best practices, following up on this stuff. The city of Rochester lead ordinance, again, proactively addressing, understanding that we're probably going to find lead in these homes. So rather than waiting to find a lead poisoned child, how do we actually make sure that we're anticipating that problem and taking care of it in the end? Because the other thing that you guys also haven't mentioned is that if a child has siblings and has an elevated blood level, you're going to be looking at those other children as well to make sure. So, it really is a holistic approach to this, right? It's not just this one isolated case. You're going to be looking at the whole family, especially like if mom was pregnant, you'd be talking to mom about that, making sure the new baby is safe. I mean, so there's really a really holistic approach to all of this.
Yeah, another point to add about maternity care, it is pretty standardized in our community that when women get tested with all that prenatal blood work, a lead level is included in that, which has been because of the work of many of our coalition folks who really promoted that should be part of the normal prenatal testing on women to be sure that they don't have any kind of element of lead in their body, which is great. Other points that should be raised.
I was just going to say, we should probably sort of sum up in some
Yeah.
way that, you should know that there's a law and that children should get tested. It's not that scary. There are lovely healthcare providers and your trusted healthcare professionals who are going to help you out. There are people who are going to follow up to make sure that you're getting the help you need. There's potential funding out there to do this, and that we as a community care about this, and there are some resources. But to not do it is really not what you want to do. You want to make sure, and you can start today, right, by making sure you're using soap and water and taking your shoes off when you come in the house and running cold water in the morning. I mean, those are 3 very simple things anybody could do to potentially reduce their potential for being exposed.
Yeah, and we have tremendous resources both in the city government and the county government. But also, I think, Elizabeth, I think it's important to mention that all the towns, the 19 towns surrounding or within Monroe County, each town government may or may not have a policy about what they expect of their contractors. And I think it's very important that families ask their town government, what are you doing about preventing lead poisoning with any kind of contract work that's done in our town? And so they should have a policy when they give out permits for any kind of significant renovation, that it should include lead safe work practices. And we've got 19 towns, so some do, very few do, as a matter of fact, but some do have a policy.
I think it's actually 29 towns, so there's a lot of them.
Oh, well, that might include the villages as well.
The villages, includes the villages, yeah.
Includes the villages, yeah. Okay.
But you're right, and I'm finding that link as well. You've got to do RRP as well, so.
I have one comment.
Yep.
Because you had mentioned earlier about the CDC lowering at what point we open up case management. And one of the things that I've been noticing, and I had spoken with Paul Hunt about it a couple of weeks ago, is we're catching them so much sooner now, because now we're getting a 1-year-old with a 5, and we can jump right on it instead of seeing a 2-year-old with an 11. So I think long term, as much as it's more testing and more cases, I think it's going to make a huge difference for these kids.
Yeah. And to your point, Linda, earlier, you certainly communicate with the family, the parents, about these results. You also communicate with us providers.
Yes.
And you let us know, what the follow-up needs to be. You're in very close contact with providers. If we have a change of address, for example, or another way to get a hold of them, you do a lot of great outreach work to be sure you find the families that have been affected. And it's been a wonderful working relationship with, I would say, with all the providers in the community and the health department, as well as the resource that we get from the city.
The providers are especially helpful because as soon as I open up management, I'm required to send a form that they fill out. It used to be more complicated, and I made a much more abbreviated version, but it reminds them that they're also required to give me the kids' latest physical, their latest hemoglobin, if they've had a developmental assessment, and if that developmental assessment has resulted in any kind of referrals for OT, early intervention, so that we get a much fuller picture, and we can also see if there's something else that needs to get done.
That's great. Andrea, I think it is, we probably should wrap up, but also I think it's important to be sure that we have the coalition's website, that people are aware how to reach us, because there's just volumes of information for all kinds of folks that would be interested in this, whether it's parents, educators, contractors, homeowners, landlords. So it's www. Lead Coalition.
I actually already put the link in the chat, and
Okay.
I put a link to the county health department as well.
Great,
And we've been putting in links to all of the things we've been talking about.
great.
Yep. So this recording will be on the Coalition's YouTube channel, and I will also be sending out a link. So all of the links that Elizabeth put in the chat, I'll be putting that in the video recording description. So that'll be accessible for everyone. And just to reiterate, the website is theleadcoalition.org.
Thank you, everybody. Thank you, Andrea, for organizing this and for all of our superheroes there that have joined us in this webinar.
Well, I also just want to say thank you to you guys and also thank you to the city of Rochester. This is actually part of the work that we're doing through a grant that we got to do education and outreach. So we are grateful to the city of Rochester for continuing to be an ongoing partner to make sure that we're getting the word out to help families, healthcare providers, public health sanitarians, whoever we can get to be involved in this whole process. So thank you so much to both Linda and to Mel for sharing your expertise today. We're really grateful you joined us. Thank you so much.
Thank you.
Oh, thank
Mel
you.
and
If
Linda.
anybody ever needs information, especially now parents and stuff, we have it available in, I think it's 20 different languages at this point. So there should never be a language barrier to educating these families.
That's great.
That's wonderful. Yeah, terrific.
Thank you, everybody.
Alrighty. Thanks everybody
Thank
for
you.
coming.
Have a great afternoon. Thank you.
Bye.
Bye-bye.